I'm Michelle Dunn, Executive Director, Franciscan Action Network. This is our webinar, Fishes and Loaves, Advocating for a Just Farm Bill. The reason we're here tonight is to learn more about the subject of hunger in the United States and what all of us Franciscans and Franciscan-hearted people can be doing to alleviate hunger and really to be pressing our government representatives to allocate the funding that's needed for critical programs so that our sisters and brothers who suffer from impoverishment and hunger can have some relief. So it's a very complicated picture. And as you might have heard, the president has just released his spending request for the next fiscal year, and it includes a massive increase in military spending and a big decrease once again in domestic spending, and that includes spending for food and nutrition programs. And that's even over cuts that were made in last year's budget. You remember last year, because of tax cuts that were given to the wealthiest Americans, programs and benefits for the poorest Americans were significantly cut back. So we're looking at more of that story, this time the cuts taking place partly so that they could go to a massive increase in military spending. So we're going to be talking about all of that this evening, trying to understand the issues better and thinking about what we can do. Now, here's what's going to happen over the next hour. Most of the hour is going to be taken up by a discussion between my colleague at FAN, Claire Fisher, who helps to lead our advocacy on domestic issues, including hunger, and a colleague of hers in the faith advocacy space, Luke McCann from the Salvation Army. I think you're going to find their conversation fascinating, and I think we'll all learn a lot. Now, you will have the opportunity to ask questions, and the way you will do that is to use the Q&A function. If you look down at the bottom of your Zoom screen, you might have to click on the More button, and somewhere you will see Q&A. And what you will do is just type your question in the Q&A box. You can put in a question at any time, and please do. Don't wait till we get to the question period. Anytime during the program when a question occurs to you, go ahead and type it in the Q&A box, not the chat, which is going to be closed shortly, but the Q&A box. And then when we get to that part of the program, we'll bring the questions forward for Luke and Claire to answer. After the Q&A, we will have an advocacy portion where we talk about an advocacy action that you can take right now. And then we'll have some announcements at the end. This is a 1-hour program. So before I'm going to turn you over shortly to my colleague, Claire Fisher. But before, of course, we always begin in prayer. And so I'm pleased to invite my colleague, Brother James Lagruda, who also works with us at FAN on poverty alleviation. And Brother James serves at the St. Francis Inn in Philadelphia. So he is serving our brothers and sisters who suffer from poverty. He is alleviating their hunger on a day-to-day basis. He knows this issue very well. So it's very fitting that he should open our event in prayer. Brother James, I turn it over to you.
Thank you, Michelle. Let us take a moment of silence to remember all of those who will go without food this evening and who do not know where their next meal will come from. Oh God, we thank you for the opportunity to gather together this evening. We ask you to watch over us as we prepare and advocate for effective solutions at the policy level to help alleviate hunger. We also pray for our elected officials that they will enact legislation that will address the root causes of of hunger in 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 this country and throughout the world. We ask this as we do all things through Christ our risen Lord. Amen.
Amen. Thank you so much, Brother James, for that beautiful opening prayer. Before we begin, I'd just like to offer a quick state of play before we hear from our expert speaker. We are here tonight because we know that hunger remains a persistent and preventable injustice in the US and globally. Hunger is not just a policy issue, but it is a moral issue tied to human dignity. Our common Franciscan values call us beyond charity to justice and solidarity with the most vulnerable. Among the most important programs to address hunger in the U.S. are SNAP, the Supplemental Nutrition Assistance Program, previously known as food stamps, and the TEFAP, the Emergency Food Assistance Program. Essentially, SNAP gives money for food directly to individuals, while the Emergency Food Assistance Program donates food to our food banks. H.R. 1, the so-called One Big Beautiful Bill, passed the 4th of July of last year, makes some of the largest cuts to SNAP in history, reducing funding, tightening eligibility and work requirements, and shifting costs to states, changes expected to reduce or eliminate benefits entirely for millions of people. As of mid-April of this year, no specific date has been announced for a full House or Senate vote on the Farm Food Nutrition Safety Act of 2026, which is commonly known as the Farm Bill. While the House Agriculture Committee passed the legislation in early March 2026, the bill has not yet moved to a floor vote, with discussions continuing on the legislative package. As we may also know, within the past few weeks, the president has released his new budget proposal that highlights national priorities and trade-offs. There's a 44% increase to the Department of War, while SNAP is being cut by 6% from just last year, with no reversals or delays included in the newest Farm Bill package. We believe that budgets are moral documents that reflect who and what we prioritize as a society, which is why we are gathered here tonight to learn more. Our advocacy turns awareness into action, ensuring voices of vulnerable communities are heard. Faith-based advocacy is a lived expression of Franciscan values in the public life, and our collective action builds momentum for systemic change and stronger safety nets for all. With that, I'm pleased to introduce our expert speaker, Mr. Luke McCann, the policy analyst for basic needs at the Salvation Army National Headquarters, to tell us more about the Farm Bill and the Supplemental Nutrition Assistance Program, SNAP. Welcome, Luke. We're so excited to hear from you tonight.
Thank you so much, Claire. Can you see my screen?
It looks perfect.
All right, awesome. So as Claire said, I'm Luke McCann. I'm the policy analyst for basic needs at the Salvation Army National Headquarters here in Alexandria, Virginia. In that portfolio, it does include food security. So it's a very much an important issue for us at the Salvation Army as well. So a little bit more information on what the Farm Bill is exactly. It's a large and transformational piece of legislation that Congress regularly reauthorizes. It's supposed to be passed every 5 years, and a new Farm Bill allows the opportunity to advance long overdue policy that updates farming, agriculture, rural land, as well as nutrition programs. The last actual Farm Bill was passed in 2018 and it expired in 2023. And since then, there have just been 1 year extensions of previous provisions from that Farm Bill. The most important title of the Farm Bill, the one that needs advocacy, is the nutrition title, which includes provisions for SNAP as well as the Emergency Food Assistance Program, otherwise known as TFAP. TFAP is reauthorized through the Farm Bill, and it's extremely important that it gets a multiple-year extension. Since 2018, it has not been fully extended for 5 years. It only has been getting 1 year. And TFAP provides food or money to food banks and pantries across the U.S. to help them serve those in need. And without that money, many of these food banks and food pantries would not be able to operate. There are other programs as well, like the Commodity Supplemental Food Program, or CSFP, that is also authorized through appropriations and contributes a great deal to food banks and food pantries across the country. This newest farm bill that Claire said is titled the Farm Food and National Security Act of 2026 is likely to be voted in the House in the upcoming weeks, according to the House Agriculture Committee Chair, Glenn Thompson. But there is, as you may know, a lot going on in Congress, so it's unclear if there will be a vote coming up. However, this piece of legislation, normally bipartisan, normally helping farmers and helping feed families, is failing to do that. The cuts from HR 1, One Big Beautiful Bill Act, to SNAP have none of them have been reversed or delayed. And Claire and I will talk more about this in greater detail as we go on in the presentation. Now I want to talk about SNAP, otherwise known as the Supplemental Nutrition Assistance Program. This is also known as food stamps. It was called food stamps up into 2008, so some people still refer to it as food stamps. And SNAP helps people who are experiencing poverty afford groceries. They get an EBT card that they're able to use at participating grocery stores. There's a lot of grocery stores throughout the U.S. that participate, and they can buy their groceries with it. There are a few restrictions. You can't buy hot meals with it. And now some states have even, I believe up to 22 states now, have even made further restrictions where participants sometimes can't buy candy or snack food or things that are considered not healthy, like juices. SNAP helps 42 million people on an average month, 42 million people throughout the U.S. And 70% of those households contain a child, elderly adult, or a person with a disability. And SNAP served on average 7.3 million children. SNAP works where the federal guidelines are 130% of the federal poverty level. If you have net assets under that, then you are qualified. But with a thing better known as broad-based categorical eligibility, states have the option to allow people to receive SNAP benefits up to 200% of the federal poverty level, which helps a lot of families who are struggling and could slip through the cracks get the food assistance that they need. So the policy changes that I was alluding to earlier, there's been many funding limitations to a lot of feeding programs domestically, especially recently. And the HR 1, One Big Beautiful Bill Act really had an impact. It was the largest cut to SNAP in its program's history. Part of this includes a cost shift to states. Without getting too much into the weeds, but if you do have questions, please ask. I'd be happy to help. The administrative cross funds, which are used to help run the program in the state, make sure that they're, getting the benefits out to the people who need it, getting applications accepted on time, making sure people are keeping up with their paperwork and everything. Normally, it was 50% of the federal government pays, and then the state pays the rest of the 50%. Starting in October of this year, October 1, states will now have to pay 75% of that cost instead of 50. The bigger cost shift is now that states have to pay part of the benefits cost. Previously, the federal government paid for all the benefits, and the state just had to pay a portion of the administrative fees. The states had to pay a portion of the benefit fees based on their error rate, and the error rate is overpayments or underpayments to SNAP recipients. Most of the time, they're relatively small, but they have to get reported if it's over $45 payment, I believe, and that counts towards the error rate. Many states have been working on improving their error rate, but with this increased cost shift for the administrative funds, some of these pilot programs that they've started to improve their technology, improve their intakes, is going to go to the wayside, and it'll just increase the error rate. So if you have an error rate above 10%, you could be paying 15% of the benefit cost. And as a reminder, a lot of states need to have a balanced budget, unlike the federal government. So if they need to maintain low error rates, because they can't afford the SNAP benefit shift, they'll either cut people off of the program who would otherwise be eligible, or they might just have other programs that need to get cut in the state budget, or they might not be able to do other things, or they'll have to increase taxes or something. There's no way that they'll be able to make this benefit switch in the amount of time that they have. That would be in fiscal year 2029 or 2028, I believe. So that is October 2027. October 1st, 2027 is the first year they would have to pay the benefit cost. There are some exemptions. States who have an error rate above 20%, which there are a few, get an extra 2 years to get their error rate down so that they can have a lower error rate and hopefully not pay as much of the benefit cost. But most states are not afforded that delay, and we're already seeing that a lot of states are having to make difficult choices. Since the bill passed, there has been a drop of participation in SNAP by 2.5 million people. And that is not because groceries are getting cheaper and people are doing better. It is because they are getting cut off the program without any other lifeline. So with that, I will turn it back over to Claire for any questions.
Thank you so much, Luke. That was a really helpful overview. Our first question is, in a federal budget context where military spending is approaching $1.5 trillion annually in this new budget proposal, while SNAP costs about $100 billion per year. Some advocates argue that even the modest reallocations could fully fund or expand anti-hunger programs like SNAP. How should policymakers and advocates think about these trade-offs? Are these truly budget constraints or value choices in our government?
That's a good question. I definitely think these are value choices. Choosing not to feed the hungry is a policy choice. We are the richest country in the world, and we still have 42 million people who are on SNAP, somewhere closer to 50 million people who are food insecure in the US. And there are programs that we see like SNAP, when given the resources, they can lift people out of poverty, get them back to stability so that they can save up money, get a new job, get more stable income, get childcare. There are so many better ways to spend the money both here and abroad. I'm not international policy, but I mean, with the food programs that are also getting cut internationally, these programs not only helped people across the world, but they're also a form of protecting American interests abroad as well. And just to increase the military budget while also veterans and military families go hungry and who are on SNAP. And one thing I did forget to mention, the One Big Beautiful Bill Act also increased work requirements for a lot of people and demographics. They need up to 80 hours of work or volunteer or some sort of class experience per month. And if they don't have that, they can only have SNAP for 3 months in 3 years, 3 months out of 3 years, or else unless they get a job. And veterans used to be exempt from this work requirement. This bill cut that exemption. It also cut the exemption for people experiencing homelessness and people who are aging out of foster care. So these are budget decisions that don't affect the bottom line. 100 billion does sound like a lot, and that is a lot. SNAP is it's a huge program, but it's the main feeding program in the United States. And to say they don't have money to help those in need get food on the table, but they can put 1.5 trillion dollars into the military, it's a values choice. It is not a crunching numbers choice.
Thank you. We often hear that food banks and charities can help fill the gaps, but SNAP delivers more food assistance than the entire charitable system combined, and food banks are already reporting strain. As you've mentioned, the Emergency Food Assistance Program is also being cut while feeling the strain. From your perspective, what actually happens on the ground when SNAP and the Emergency Food Assistance Program are scaled back? And where does unmet need show up?
Uh, Um, I believe there's a statistics from Feeding America, which is the largest food bank provider in America. For every one meal that a food bank provides, 9 meals are provided by SNAP. So for government officials to say that the nonprofit sector can just take over is completely untrue. Last week, I was actually in New York City visiting some of our Salvation Army sites that operate food pantries and food banks. So they've received some TFAP funding, and this funding is essential to them. Some of these locations in Lower Manhattan are doing 500 meals a day, and 75% of that money is coming from TFAP. Last year, I believe in the spring, TFAP funding was frozen for weeks, and we heard it from all over the country about food banks not knowing where they were going to get their food from. Food banks that were able to provide fresh fruit and vegetables for people were no longer able to. They had to do canned goods. Food banks that were able to, restore some dignity back to people who may not want to have to be in this situation where they were able to have like an actual grocery kind of setup where they could go and pick their own food, weren't able to do that anymore. So these are all like very significant issues that are felt on the ground by real people in real time with just with a week of funding cut. When we saw that SNAP was frozen because of the government shutdown, many food banks and food pantries throughout the country saw a huge increase. I know the Salvation Army saw a 300% increase in the month of November, and that was mostly new people too, and that was because SNAP was frozen. Their benefits were frozen for that month. So it's something that the nonprofit sector can definitely not do on its own without the federal government's help.
While we're also talking about the nonprofit cuts, could you also talk a little bit more about the error rate cost shift compared to the administrative cost shift? Just a little bit more explanation there.
So the error rate cost shift. So states administratively run SNAP. They get the money from the government for the benefits, and then they administer SNAP. People apply for SNAP or they reapply every 6 months to a year, depending on your job situation and your family situation. If you have elderly people or disabled individuals in your household, then I believe there's a little bit more leeway with applications. And these states and these administrations that run these programs in the states already underfunded need to make sure that they're keeping up with these systems. And a lot of these systems are older, so a lot of these states were implementing newer technology to make sure that they could improve their error rate. And the error rate is any overpayment or underpayment of SNAP benefits to a person who's supposed to receive SNAP benefits. It's not going to people who aren't supposed to receive SNAP benefits. And you have to report the error rate as it counts towards your percentage if it's over or under $47. And this happens quite frequently because, again, states are overwhelmed, but they are trying to improve it, and some have already started to improve. So these over under payments, again, then once they're caught, the money is either the money that was due to the person is given to them, or the benefit is then a little bit less following issuance of benefits. So the error rate then determines how much these states are going to have to pay of the benefit cost, which states have never had to previously pay. And the benefits for the whole country is around 100 billion. Some states obviously have more SNAP participants just because of the population. So if you have a higher error rate, if you have under 6%, then you don't have to pay any of the benefit costs. 6 to 8%, you have to pay 5%, and then 8 to 9.9%, you have to pay 10%, and then over 10%, you have to pay 15% of the benefit costs. And I believe it is something like, according to the last error rates, I believe all but 8 states, I think, would have to pay at least some portion of the benefits, and some, like, I think over 12 would have to pay 15%. And these are going off of error rates from this past fiscal year, or the fiscal year prior. They can choose which year. But again, the administration is not um, giving any leeway with error rates during the government shutdown. So when there's a government shutdown, there's obviously less employees, and then once the government opens, they're trying to get the SNAP benefits out immediately. And there tends to be more error rates there. They're not giving any leeway for that. So a lot of these states are struggling to keep their error rate down. We see Arizona since July has had a 47% drop in their SNAP participation. And there's I mean, you can't say it's solely because of these new rules that are getting implemented, but a lot of these states are extremely worried about being able to pay these increased costs and keep a balanced budget.
As these new cost shifts have been outlined in HR 1, do we know how many people have been cut or rolled back from SNAP since last summer?
Yeah, so just since July, when the bill was passed, there are now 2.5 million less people on SNAP per month. And that's a significant drop in just 7 months. This is from July to December. So the statistics have not come out yet for January, February, March. And a lot of the increased work requirements had to be starting to get implemented by the end of 2025. So these are without the increased work requirements for, they call it ABODs, which is able-bodied adults without dependents. But it's a little tricky because adults with a child 14 and older also need to meet these work requirements. And again, we're talking about people who are low income families where jobs aren't necessarily always steady. You're not always working 20 hours a week. You're not always getting 80 hours a month. And you have to also pay for childcare. And a lot of these families are single parent households where they can't find childcare or they can't like get steady work because of their children because they have to care for their children. So 2.5 million people already in just several months is an astonishing number. And again, these people aren't off the program because they're success stories. They're off the program because they were cut off the program.
When we see these increased work requirements and more shifted responsibility to the states, we see that there could be changes to the effect of the long-term effectiveness and accountability of SNAP. Do you think that any cancellation or reduction of federal hunger data collection could also play a factor in this?
That's a really good point. So Claire's alluding to this study, this test data collection that was done every year by the Agriculture Marketing Service that goes into detail on food security in the United States. It's the Food Security Report, and it's administered with another census questionnaire, and it gives an idea of food security in the U.S. And I believe per the last report, it was close to 50 million people live in food insecure households. Many of them children. I believe over 11 million were with households with children. And then there is deep food insecurity where they're skipping meals. And that was a significant number as well. I'm sorry, I don't have the exact number on me right now. But the the Trump administration, canceled this report abruptly, saying that it was redundant and propaganda and fear mongering. It's not. I mean, it's a vital report. It's vital because it shows the picture of what's going on in America if these programs are working. It's used by nonprofits to see because it can go by regional, by state. It goes to see where they might need to make a better effort to help people in need. So canceling this report just hides the problem that's going on. It puts a band-aid on it and it doesn't really help at all. It just disguises what's really going on because we do know that grocery prices have not gone down. They're the same or even more expensive in a lot of ways. And people are struggling because there's inflation as well. And, with the war, gas prices are going up. And if we don't have this data, then we can't really paint a full picture of what's going on. There are nonprofits that do more local data collection, but this is a federal level data collection where they get thousands and thousands of responses, and it really gives a picture of what's going on.
I'm going to offer Luke one more question for our panel portion. So please continue submitting your amazing questions into our Q&A function, and we'll be able to address them in just a couple minutes. Luke, my last question for you right now. Sorry. Now that we see hunger is at a risk of rising and is rising, including roughly 180 to 190 billion cuts under the One Big Beautiful Bill, how do we reconcile this contradiction as hunger is rising and cuts are going up as well? Is this about fiscal necessity? And are we seeing a shift in how policymakers see the role of the federal government versus the state government to address hunger as an issue?
Yeah, I think that's a good point. I think they want states to be more responsible, and we do understand that, you do want them to get their error rates down, but I think punishing them by making them pay more is counterintuitive and just a vicious cycle that is just going to snowball until some states might not even be able to run the program anymore. The thing is, again, the cost, like the shifting the responsibility to the states. There are many states that are net negatives that get money from the federal government, more money from their federal government than they put in, and do not have a lot of output. And these are the states that need the most help. These are the states with the highest poverty levels, the most food insecurity in a lot of cases. And if then they're left to their own devices to try to solve this problem, they're not going to be able to do it. And I think it's been guised as going against fraud, waste, and abuse. And there's always going to be fraud in every federal program. That's just the reality of it when you have that amount of money in any federal program. But it is extremely low. Rarely any of the fraud actually comes from people trying to get SNAP benefits that they're not owed. There is issues with skimming, which is because a lot of the they're EBT cards, but they don't have a chip, so they're easy to skim and take money off of that. That is a big problem that lawmakers have tried to, and we're going to pass a bill about it, but have not yet, to make it mandatory to have chip cards so that they're more secure. But none of this fraud is coming, rarely any of this fraud is coming from the participants. These are people who need this benefit, and the federal government is the only thing that can run it effectively, can afford it. Again, a lot of these states, just looking at what their cost shift would be based on their previous error rate, they're paying hundreds of millions of more dollars a year for just SNAP. And a lot of states need a balanced budget, which means they can't spend more than they're taking in. So they either need to increase state taxes or local taxes, or cut other programs, or cut SNAP program altogether. They don't have to opt into the SNAP program.
Do we see a likelihood that many states will cut SNAP entirely from their state budgets?
Honestly, I hope not. I haven't, again, it's still too early to see. We haven't had the new error rate come out for the first year that they'll be looking to choose from. So they get to choose from fiscal year 2024 or fiscal year 2025, I believe, or it's 2025 or 2026. And those error rates haven't come out yet. I think with the administrative cost shifts, most states are going to be able to afford that. It's going to be a big hike going from 50% to 75%. But again, I think you're going to see a lot of things like Arizona, where they literally within 6 months have had a 47% drop in their SNAP participation. Virginia has had a 12% drop. The drop in SNAP participation is 6% nationwide since July when this bill passed. And I think it's only going to get deeper in a lot of states. And again, it's going to be a moral decision for a lot of these states. What do they do? What do they deem is more important?
Thank you. And those statistics are just so jarring.
Mhm.
At this time, we're going to move into our Q&A function from our participants. We have about 15 minutes for this portion, so we're going to do our best to go through the questions that our participants have sent in. Could you explain a little bit more about why nutrition programs are included in the agriculture budget rather than another department such as Health and Human Services?
Oh, that's a good question. So the USDA is honestly a huge government agency. They have control over a lot of things. Obviously, farming, rural development. So they go into the energy sector a little bit with rural development when they're doing updates to grids and stuff like that in rural communities. And then since the inception of a lot of these nutrition programs, they just fell underneath the USDA, the Agriculture Department, specifically within a branch of the Agriculture Department called the Food and Nutrition Service, also known as FNS. And then again, very confusing with all the funding, but some of them are funded through the Farm Bill, which happens every 5 years. Some of them are funded through appropriations, which is an annual thing. And so one program that is funded through annual appropriations, WIC, which is the Special Nutrition Assistance Program for Women, Infant, and Children, that is annually appropriated through Congress. And that is another one that was not mentioned in the presidential budget, which is good. But it was fully funded last year, and that remains to always be a fight to ask for full funding for WIC. So that would be just something I mentioned. But yeah, it's kind of always been that these nutrition programs were just under the USDA. It kind of makes sense because a lot of them work in like connected with farming. So like the Emergency Food Assistance Program that connects farmers with food banks and USDA food distribution centers where they drop off the food there, then the USDA drops it off to a food bank. Or the Commodities Supplemental Food Program is supplemental food from farms that is given to food banks. So it's like it's very interconnected. That's why it just makes sense to have them all underneath the same agency.
That makes a lot of sense. Could you talk about how our tariffs affect hunger and food insecurity?
Yeah. So I'm not expert on tariffs, but I know that there was a lot of retaliatory tariffs too against farmers in the U.S. And a lot of farmers in the U.S. export soybeans. So when their soybeans weren't getting sold anywhere, the either the federal government had to step in and buy themselves. Then that was using taxpayer money to supplement farmers that would have otherwise needed it if there weren't tariffs. And then, we do get some food from foreign imports. We get some beef, bananas, avocados, things like that. Like a lot of fruits and vegetables get imported. And then when those tariffs are implemented, the it goes to the consumer because when they're bringing it in, the tax is on the importer, not the exporter. So the importer has to pay a higher tax, and then they still need to make a profit. So then they pass that on to the consumer. So that's why you see an increase in a lot of like fresh fruits and vegetables that aren't typically grown in the U.S. is mainly due to those tariffs.
We're getting a few different questions in the chat about the federal responsibility to help our hunger programs and the state responsibility. When people are going into offices advocating for this, is there a best response to those who say, well, we want the states to have more accurate error rates? We want them to have that responsibility. How do we advocate and what do we respond with this type of resistance?
So, I mean that's a good point, and we agree. Like everyone should agree that you want the error rates to be down. That's like something that everyone wants. They want to improve the error rates, but the thing is, they need number one time, and they need money to be able to do it. So there is one bill that was not added to the Farm Bill in the House Agriculture Committee, which can still be advocated to get added to the Senate version, was to delay the benefit cost shift based on error rate by 2 years for all the states. Because right now it's delayed for the few states that have over a 20% error rate. And that delay will then give states more time to improve their systems so they can lower their error rate and then not have to pay such a huge benefit cost shift. So if they're given this time, they'll utilize responsible ways to improve their error rate instead of what we're seeing now where states are simply just cutting people off of the program because they don't want to have a risk of getting their error rate increased.
When we're talking about different SNAP participation in different states, do we see higher rates of SNAP benefits and participation in certain parts of the country or states that are traditionally red or states that are traditionally blue? And why might that be the case?
Yeah, I mean, it depends. There's definitely, I mean, so with some red states that I've noticed with my research, they have a high level of poverty. Their poverty rate is high, but their SNAP participation rate is low. So some states with high poverty rate just don't end up participating in SNAP. There are red and blue states that have high participating rate of SNAP, California, and obviously it's just because it's a huge state. Texas has a lot of participants, Florida has a lot of participants, and these are states with, population centers, but also people like don't realize how many people in rural communities have to use SNAP, which if you think about it is very ironic because they're the ones who are growing the food for us and they need to be on SNAP benefits. And, there's only so many grocery stores in these areas as well. So if these grocery stores are losing money from having less SNAP participants, then they're going to shut down and rural people living in rural communities will have to go even farther to get food. I have a real quick stat about the fiscal benefits of SNAP. This is something you could also use. SNAP accounts for 12% of grocery sales in the country, 243,000 jobs, $16 billion in wages, $1 billion in federal taxes, and almost $1 billion in state and local taxes. So SNAP puts back into the economy. It's not just like it's not just the handout thing that some people say. It puts money back into the economy. It puts jobs into the economy, and it helps put food on the table.
100%. While we're talking about the grocery stores, you mentioned a little bit about the foods that people are able to purchase with their EBT cards. Could you talk a little bit more about those categories and what is still available versus what is not?
Yeah. So depending on the state, sorry, let me see if I
Yeah,
but there has always been a restriction on what you can buy with SNAP food. You can't buy tobacco products or anything like that, and you can't buy hot meals. But recently, uh, there has been a push for with the MAHA movement, Make America Healthy Again. There's been a push for um, uh, limiting even further what states can buy. And a lot of these restrictions evolve around um, sugary foods. So, like, again, some of these states have way more like basic uh, kind of jargon around it. Some are very specific, but like sodas, juices, if it's not like 100% real juice. And again, also don't want to push back on trying to be healthier, but restricting someone from purchasing what they want just because they're in a benefit program. So they can't buy a cake for their kid for their birthday because that's too sugary or too processed. And sometimes those are, the cheapest foods that they can afford with their SNAP benefits because the SNAP benefit is around $6 a day. So it's not like it's a huge benefit. And the cheaper foods tend to be the ones that are more processed. So unless you're going to make the more organic vegetables, fruits, and healthier foods cheaper, restricting foods further does not benefit anyone.
and then our last question for this portion, we have a question about the data collection of food insecurity.
Mhm.
Can we use the SIPP data from the Federal Reserve or census data from American Community Survey to estimate poverty? Or could we create a national simulation to show the food insecurity data?
That is a really good question. I might have to get back with that question with a full thought out response. I do know that some bigger nonprofits that collect data as part of their big thing, they're trying to fill in the gap with this food security report. The problem is like this is a questionnaire that's sent out with Census Bureau questions that people need to answer. So then they're more likely to answer the food security part, and you get a high rate of participation in the response. And it's very like it's varied. It's pretty representative of the United States demographic. So I think there are nonprofits that are trying to plug in the gap. I would have to look more into the survey of income and program participation to see if that could be another source. But again, I know there are people looking into it. So the last report was published in the fall. They were supposed to start doing the next report in December for 2025, and obviously that is not happening at this point. And this report is conveniently enough not happening as soon as these cuts to SNAP happen, where it's likely that there will be an increase in food insecurity in the US.
Luke, thank you so much for all of this education. Your overview, your questions have been great. For all of our participants, we're going to include Luke's email in our follow up email. So if there are any further questions, feel free to reach out to him or a staff member at FAN. Luke, thank you so much.
Yeah.
Now that we are also continuing our education, we want to move this education into action. We want to urge Congress to pass a moral budget, and we want them to protect the dignity of all of our people, one of our most basic tenets of our Franciscan spirituality. So don't worry about taking notes. All of this information will be included in our follow-up email as well. But we are going to encourage our people participating this evening to visit congress.gov to find out who your representatives are by entering your address in the top right corner. And then you will be directed to each of your members' websites with their contact information, whether that is a in-district phone number or a Washington, D.C. phone number. We'd ask that you would speak with a member's legislative staff who covers agriculture, nutrition, or poverty assistance. You could also leave a message on the member's voicemail. You could share your name, address, and if you are a constituent. Share your concerns with our talking points that we will be sending in this email. We'd ask that you convey your values as why this issue is important to you, specifically inspired by our Franciscan tradition, affirming the dignity of every person and the call to care for those in most need. Emphasizing that budgets are moral documents and should reflect care for people experiencing poverty and hunger. So, what are our main asks once we're having this phone call with someone from Congress? We'd like to urge the members to provide robust funding for the programs that help meet the most basic human needs in the Farm Bill. Number one, to fully fund and protect SNAP, the Supplemental Nutrition Assistance Program, which provides food benefits to low-income families. And number two, fully fund and extend TFAP, the Emergency Assistance Food Program, which provides emergency food assistance to states and food pantries. Franciscans are so often found in soup kitchens or volunteering at food pantries. And we'd invite you to share a personal story if you feel that that's relevant to you. If there's a story about you and your clients, you, a family member or neighbor relies on SNAP or food assistance, your personal story adds so much to your phone call. Once you've emailed them or sent them a message, we'd invite you to follow up with them, sending a short second call or email, reinforcing your message, and spreading the word to your families and friends. At this time, I'm going to invite Brother James to end our evening in a closing prayer, and I'm going to pass it to Michelle Dunn, FAN's Executive Director, for a few closing announcements.
Thank you, Claire. Let us take a moment in silence. God, we thank you for this time together this evening. We ask you to help us as we find effective means of advocating for a just and a moral budget that will benefit everyone, but especially the poor and the most vulnerable among us. We especially once again ask you that you watch over those who will go without tonight and who will wonder where their next meal where it will come from. And Lord, help us to be instruments of your peace in all that we do. We ask this as we do all things through Christ our risen Lord. Amen.
Thank you so much, Brother James, for that prayer. I want to thank my colleague Claire Fisher, who put this webinar together, and our guest from the Salvation Army, Luke McCann, for sharing his expertise with us. As we go, I just wanted to mention a few upcoming events that you might want to put on your calendar. FAN will be holding its annual benefit online. Again, this year, the online event is June 16th. And as many of you know, we have started holding our benefit dinner in a soup kitchen. And this year, it's going to be in the Capuchin Soup Kitchen in Detroit, which is run by the Capuchin Friars there. So the FAN staff are going to travel to Detroit. We're going to serve a meal and pay for a meal there on behalf of all of you. And we're going to take a lot of wonderful video footage while we're there. And then we're going to have a wonderful program for you online Tuesday, June 16th. It was in our newsletter, and you'll be getting a full email about that shortly. Another thing to put on your calendar is our fourth Franciscan Justice Leadership Conference, where we would welcome you to a wonderful intergenerational gathering here in Washington. Many college students attending, as well as Franciscan-hearted people from across the country to learn together and go to Capitol Hill and do advocacy together. That's going to take place November 7th through 9th here in Washington, D.C. And registration is now open. I hope to see many of you there. The last thing I want to mention is that Claire and Brother James and I are going on pilgrimage to Assisi with a group. We're doing it jointly with Pace Bene Nonviolence Service, Peace and Justice Pilgrimage to Assisi, starting 1 week from today. So I ask you to keep us in prayer and think about joining us the next time we go. God willing, we'll have another Peace and Justice pilgrimage in 2028. So that's it for tonight. Thank you all for being with us. Look for the follow-up email in which you'll receive a recording of this program and all the resources that were mentioned. Thank you so much for your interest in alleviating hunger and for all of the advocacy that you do that is rooted in the gospel of Jesus Christ and the values taught to us by St. Francis and St. Clare of Assisi. God bless you all. Thank you for being with us. Good night. Peace and all good from the Franciscan Action Network.